أعوذ بالله من الشيطان. Thank you. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Thank you so much to everyone for joining us today. My name is Dr. Wajid Akhtar. I'm the Assistant Secretary General of the Muslim Council of Britain and your host for the next hour. Welcome to the Big Conversation event hosted by the Muslim Council of Britain, the Greater London Assembly, including the Office of the Mayor of London, the Office for Health Improvement and Disparities, OHID, the London Association of the Directors of Public Health, ADPH, NHS England, the London region, and the British Islamic Medical Association. You can see all the logos above my head. As I said, my name is Dr. Wajid Akhtar, and I'm going to be sharing some questions and some thoughts that people will be asking to the panelists with our distinguished guests. But first, some general housekeeping. This is a virtual meeting, so as usual, we'd like you to be on mute if possible, and we'd love to hear your questions. The actual event is called The Big Conversation, not The Big Lecture. So we want this to be interactive. We want you to ask your questions, your thoughts, your concerns, anything along those lines. All we ask is that you keep them on point and respectful. Oh, and concise. So I know that sounds like a lot of things, but hopefully after 2 years, we've got the hang of this. The meeting is being recorded, but the idea is so that we can share clips from it in order to promote the main messages to the general public. So first of all, we're going to start off with asking, why are we doing this event? Because there's so many events like these happening all across the country, but why this particular event? And to answer that important question, I'd like to invite Dr. Debbie Weeks-Barnard to do an introduction and to give us a call to action as well. Dr. Debbie Weeks-Barnard is the Deputy Mayor for Communities and Social Justice, and she works to promote social justice and equality for all communities and is a key player in driving London's social recovery from COVID-19. Dr. Debbie Weeks-Barnard.
Thank you so much, Dr. Wajid, and welcome to all of you to our big conversation. I did very much enjoy what you said there about this being a conversation and not a lecture, and that's entirely what we intend for this to be. So can I just welcome you all and thank you for spending the next hour or so with us this evening. I'd also like to thank our partners in this event today, the Muslim Council of Britain and the British Islamic Medical Association, as well as all of the partners that Dr. Wajid listed, NHS London and the Office for Health Improvement and Disparities among them, because all of those partners have helped to make this session possible. And I want to start just by saying to all of you, we are here to discuss a really important set of issues, worries, concerns, thoughts that people may have about the ongoing COVID pandemic, and indeed about the particular Omicron variant, which we know is rife at the moment, particularly here in London. And so we're having this set of conversations at this particular moment in time to make sure that people have all their worries and answers answered by the experts who will know an awful lot about the best ways to keep ourselves safe, what some of the restrictions might mean for all of us, but also some of the worries and anxieties that people may have had about the vaccine rollout from its inception. And so this really gives us an opportunity to try to answer as many of those questions as we possibly can. So I know that many of us are quite worried, very worried indeed, about those rising cases of the new Omicron variant and indeed the reintroduction of public health measures, including mask wearing and testing for international travel. And we are once again facing high levels of uncertainty. And so I really want to reassure all of you on the call on behalf of the Mayor of London and the GLA that we are here and alive to your concerns. We will continue to do all we can to support Londoners through these new challenges. So today is a chance for us to hear about the vaccination programme and what we can all do to try to manage the spread of this new dominant variant. There'll be some time for our expert panel to answer your questions, but also for you to hear from them. And we've organised this session to make sure that you can get answers to your questions and concerns. And I really do urge you to use this opportunity to ask anything at all to our panel of experts in relation to Omicron, or indeed just to the pandemic itself. And following this call, we will share details of where you can go to find useful resources and information that you can share with your networks to ensure that you are as informed as possible and that you can continue to inform the communities that you represent, that you might support, or indeed your friends and your neighbours as we go into the bank holiday and festive period. We know that we can only remain safe together, and that it's important for us to continue to care for each other. And even more importantly, I think for us at the Mayor's Office, to do all that we can in our power to make sure that the health inequalities that have got so much worse for Black and Brown communities during this pandemic do not worsen. So please do share all of those resources that we will be sharing with you today. Do ask those questions that you might have. Do raise with us issues that you feel that we may not necessarily be aware of, so that we can continue to ensure that our response to this pandemic is as informed by you as possible, so that we can continue to do all we can to support you and keep you protected and keep you safe. I will now pass back to Dr. Wajid, who will be chairing the rest of this session today.
Thank you so much, Deputy Mayor Weeks Barnard. And I just want to reiterate the point that you're making, because I found out that the entire team behind this has just been working on another webinar. They just finished and they've just gone into another one. So this is something that's really important to everyone who's involved today. And we hope that you're going to, get some benefit out of it. But now that we're kind of aware of the problem, what is the scale of it right now? What's going on here in London? And to answer that question, we have Dr. Tahseen Khan, who is a GP in Stamford Hill. He's a clinical director of Springfield Park Primary Care Network and the vaccine lead in City and Hackney. But even more importantly, he's a senior clinical advisor for the London COVID vaccination program. So he's someone really well placed to tell us, what's the scorecard here in London? How are we doing? Are we doing well? Because we keep hearing in the news that London's terrible. I heard, some of my relatives say that what's it like in COVIDistan? And I was like, hang on, we're not going to take that lying down. But what is the situation like in London?
Thank you very much, Dr. Wajid, and thank you for the introduction there. And Assalamu alaikum, everyone. So as Dr. Wajid said, I've been quite involved with the vaccination programme for the last 6 or 8 months, really, and both from an operational point of view in the vaccine centres, but also from a strategy point of view, working with the NHS London team. And in the spirit of not wanting to turn this into a lecture, I'm just going to give a few key headlines because I want to spend most of the time with the Q&A. But as Dr. Weeks Barnard said, that we are really worried about the Omicron variant. It is spreading very quickly across London and in the entire country. So it's something that we're watching really closely. If you look at the numbers, there's doubling of cases week on week. And yesterday, for example, Lambeth had the highest numbers of infections in the entire country, with up to around 5,000 people per 100,000 of the population testing positive for COVID. So it's something that we're watching really closely, because what we're worried about is that actually if you superimpose those areas that where the vaccination uptake is lowest, that's where we're worried actually that infection with the Omicron variant will mean that people end up in hospital, and unfortunately there'll be more deaths to come this winter. So that's really what we're trying to avoid as much as possible, because don't forget, we've still got cases of Delta variant, and those cases were quite high. So we're actually dealing with two fronts here: the very transmissible Omicron variant, but also the Delta variant that was pre-existing. And there is some suggestion that the new variant is less severe, but that is a big if. We don't know this yet. And because of the vast numbers of people that have got this variant already, the risk is that even a small percentage of those people ending up in hospital can really put pressure on services. So this is very serious. We're really worried about this Omicron. So it's not just a minor illness. It's something that has real impact on our day-to-day life, and potentially meaning that we'll have more restrictions to come. I was I'm currently at my surgery, and I've been at my surgery all day today, and the number of positive tests that are coming back, I don't think I've ever seen my inbox so full of positive cases. But what we know is that vaccination is the best way to protect yourself and others this winter. But we know that 2 doses aren't enough for the Omicron variant. So my plea to everyone on this call is that if you're due for your booster, i.e. if it's been 3 months or more since your 2nd dose of the COVID vaccine, to please book in for your booster as soon as possible. You can also go into a lot of walk-in sites. So if you search for NHS Grab a Jab on your search engine, it'll come up as the first link, and you can put in your postcode and find out where the nearest walk-in centre is. And to answer your question around how London is doing, I mean, over the past week or so, we've been working flat out. So there's more access to vaccinations than there ever has been. There's been 24-hour clinics in Haringey. I know our centres in Hackney doubled capacity over the last week. We're opening up till 9 o'clock at night and accepting walk-ins. Community pharmacy has really stepped up, and we're also doing a lot of housebound vaccinations. So there is somewhere that you can walk in very close by to you. If you go onto the NHS website, you'll be able to see all the walk-in locations. And as well as that, we are doing a lot of pop-up clinics, particularly in areas of low uptake, to try and increase the rates of both the 1st and 2nd dose, and also the booster. And I do want to reiterate that although the emphasis is on the booster, the people that I'm particularly worried about are those people that are yet to have their 1st dose, because we know that they are particularly vulnerable to COVID. So please, it's never too late. Walk into a vaccination centre, you will be welcomed, and no one will judge you for not being vaccinated. Really, it's never too late. And the other key message I want to say is to have your flu jab if you're eligible as well, because what we know is that having both flu and COVID at the same time really leads to serious complications, and we are seeing increasing flu rates this year as well, and you can have both flu and the COVID vaccine at the same time. So overall, lots of access across London, and we were ready to vaccinate when you feel the right time is, and ideally as soon as possible, with the rates going up so quickly. But I just want to quickly also say that vaccinations aren't the full story. So we also want to make sure that people are following the guidance around hands, face, space, all the usual stuff, and maximising social distancing. Obviously, we're going into the festive period. If you are socialising, to mix with as few people as possible, and ideally outdoors, but given the weather, I know that's not always possible. If you are indoors, to ventilate the room as much as possible so that you are dispersing the virus if someone does have it. And then making sure that you do twice weekly lateral flows, and everyone should do that even if you feel well, because that will help pick up any signs of infection even if you don't feel unwell. So it's really important that you go ahead and order the lateral flow test. You can do that online, or you can call 119. And the last point I want to make is that if you feel unwell, not to do a lateral flow test, but actually to do a PCR test, and you can order that again on the NHS website, or calling 119. And crucially, you need to self-isolate if you become unwell, because this virus is very transmissible. So the risk is that if you are around other people, that you will spread it. So those are the key messages that I wanted to talk about today. I'll hand back to you, Dr. Wajid.
Thank you so much. That's a whistle-stop tour on the state of COVID overall and London. So thank you so much for all the work that you're doing and for giving us those reminders. But now I guess it's part of that panel time where we try to answer the questions that you're asking. And I'm really grateful that people are putting questions forward, and we will get to all of them. But before I do that, it would be nice to introduce our panel to you. It's important that you know who these people are that are answering the questions, that they are people who have been involved in COVID, who are involved in treating it on the front line. And therefore, their answers aren't just opinions that we can often find, unfortunately, on social media where people without qualifications are giving it. I'd be grateful if you could introduce yourselves, although I'm happy to introduce you as well. We have first Dr. Muhammad Hakamal. If you could introduce yourself, please.
Well, my name is Dr. Hakamal. I'm the former Chief of Public Health from Afghanistan, public health expert, currently lecturer at the City University of London. I have been involved in Southeast Asia country, in response to COVID-19 and several projects.
Thank you. And this will be a recurring feature with all our panelists. I think they're going to be very modest and not tell us exactly who they are completely. But Dr. Muhammad Hakamal actually led public health for an entire country in Afghanistan, and it's a real pleasure and honor to have you over here. You're award-winning in the work that you've done. You've done projects that have made a difference to tens of thousands of people. So we're very grateful to have you here. We also have Sister Sharifat Muhammad Kamal, who is from the British Islamic Medical Association. Sister Sharifat, do you mind introducing yourself?
I'm Sharifat Muhammad Kamal. I currently am one of the clinical lead for Pharmacy to You, pharmacy-led COVID vaccination center. And at the moment, we have the IS pharmacy that give COVID vaccination. And my message today, at this moment, is just to continue to encourage people that pharmacies are open. All pharmacies, community pharmacies, they are open to support you with queries, with questions. And we even encourage couples to come together, families to come together for their vaccinations. And some pharmacies are open 24 hours as well. So this will enable us to support the community to just get rid of this virus as much as we can. Thank you very much.
You're welcome. And Sister Sharifat is also an executive committee member of the British Islamic Medical Association. She's been involved in a lot of our projects and doing a lot of work on delivering the COVID-19 vaccination into arms day in and day out. Last but certainly not least, we have Dr. Zerbachan, who's also part of the British Islamic Medical Association and a fellow GP. Dr. Zerba?
Assalamualaikum. I'm not really sure how much else I have to add, but yes, I do work with the British Islamic Medical Association. I'm a GP, and I've worked with the local Muslim community towards especially the beginner in our communities to have the vaccine, particularly women. So inshallah, I hope to think we are quite far ahead of that now, inshallah.
Brilliant, thank you. And what Zerva didn't tell everyone is that she's also the head of our publicity and public relations team. So trying to spread that message out to the wider community. Okay, I hope I haven't missed anyone, but if I have, please let me know from our panelists. And obviously we have Dr. Tahseen, who will be continuing on, who we introduced earlier. I want to start off with by saying that I'm going to play devil's advocate here. I'm going to try to be a little bit contentious in the questions I'm asking, not because, just because I want to troll online, but because I think it's really important that people have their questions answered in the way that they feel that they've been asking it online. So, for example, the first question I'd like to ask any of our panelists is that, according to the latest statistics, 90% of people have had their first dose. 81% have had their second dose, but only 44% have had the booster. Why the discrepancy? Is there like a lack of faith in getting the booster? Why is it the number of the boosters just not caught up yet with the first or second dose? Does anyone want to take that?
Yeah.
We can start with, yep.
So I think it's a variety of reasons. I think part of it is vaccine fatigue. I think people have been hearing so much about COVID vaccines, and I think there was a sense of 2 doses. The messaging was that 2 doses will protect you, and I think because COVID is an evolving picture, and that sometimes unsettles people. So people think, well, hang on, the science said 2 doses is enough. Now you're saying a 3rd dose is needed or a booster is needed. And that leads to some people reducing in confidence, thinking actually, did they ever know what they were talking about in the first place? And I mean, my answer to that is that actually science in its very nature is evolving. So we look at data, we look at what's going on in the world, we look at how many cases there are. And what we saw, for example, after the 2 doses was that actually immunity does start to go down in some people after 6 months. And given the threat of this new variant, the Omicron variant, being so so rapidly spreading. I think that's why the guidance changed, and we rolled out the booster program really quickly. And I think some people haven't quite caught up to that message. And also, I think there's some thoughts around this virus is quite mild, particularly the new variants, and people are saying that actually the data from South Africa is showing that it's milder than other variants, and there's a few dangers with assuming that. First of all, the population of South Africa is very different, it's much younger, and secondly, actually they had a big wave of Delta, and so we think that that's partly why actually hospitalizations were lower in South Africa. So we don't know whether that will be replicated in the UK. So I think some of it is actually people feeling saturated by messaging of vaccination. Some people thinking two doses is enough. Actually, we need to go back up to about 70 to 75% effective against the new variant. So yeah, it's very much about keeping the conversation going as much as possible.
Thank you so much. Dr. Hakamal, I'd like to ask you a question. In terms of public health, so a lot of people are saying it does seem like it's more mild, and they know people who've got the Omicron variant, and they said, oh, this is much more mild. Then, do I really need to get the vaccine? Do I really need to get the booster dose? Why should I get it? Why don't I just get this milder form of COVID? What would you say to people who are thinking along those lines, making that strategic decision in their heads to say, oh, I'd rather get the milder COVID than get a booster shot?
Well, I think one thing which is very clear is vaccine is very protective, very important also to protect ourselves, from any variant of COVID-19, if it is Delta, if it is also Alpha, if it is also the same for Omicron. So like what Dr. Tassin Khan was mentioning, still there is a problem in terms of communication. So like sometimes even with WHO is also sharing that, well, that is totally clear that we don't understand, about the severity of the disease, and also several things is also uncertain. So the level of uncertainty is very high. So that causes also create a kind of, confusion in the community. So when we talk also with the community, so still they are I had similar discussion also with several people also in our community. But I was also told the same thing, that, well, several things is not very clear. It's very high level of uncertainty, even in science, even in public health. So once we have, that clear response from the science, then it will be easy for us also to take the decision. Apart from that, still I'm also seeing a kind of, challenges also in communication. So I think that the level of messages that we are sharing with the communities, that also need to be very clear, even if there is very high level of uncertainty. Still, vaccine is very important for us, to save our life, to save NHS, to save everyone, to save our community. Even that level of uncertainty is not something that will also put us, confused whether to take, vaccine or not vaccine. I think we need to coordinate, all the messages at the community level, from the public health side, from the NHS side, from academia, so whoever is also discussing the messages, to tell to the community that vaccine is, the only option for us to protect our communities, along with the preventive measure. So preventive measure is always important for us until we reach, the herd immunities in the community.
I think that's a fantastic point. We all like saying that in medicine. The prevention is the best cure, not catching the disease and hoping you make it, and hoping you don't get long COVID, and hoping you survive, and hoping you don't pass it on to somebody else who'll become unwell. Prevention is the best cure. That's a fantastic answer. Thank you so much. People are a little bit confused, and we often find this in general practice because they're surprised they've got the new variant. They're not coughing, and they don't have a loss of smell or taste. So what are the symptoms of the new variant that people should be watching out for, which may be slightly different to previous variants that have gone around before?
So the question is still the same also for me, Wajid?
We can, or anyone, if anyone wants to take it. Dr. Tassin?
Yeah, sure. So yeah, So as you mentioned, the initial symptoms were around cough, having a dry cough, fever, shortness of breath. And then with the Delta variant, actually, there were other symptoms that people were complaining with, so nasal symptoms, throat itching, etc. So more cold-like symptoms with the Delta variant. With the Omicron variant, similarly, people are they're describing quite a lot of cold and more flu-like symptoms. So I think the general advice is that if you have any symptoms around a runny nose, itchy throat, feeling excessively tired, muscle pains, fever, shortness of breath, anything that feels like a cold or a flu, or if you think you've got COVID-like symptoms, i.e. shortness of breath, fever, anything at all to do with your nose, throat, feeling excessively tired that you can't explain, the safest thing to do is to order a PCR test. And you can do that, as I said, by going online on the NHS, or you can call 119. And that would be the best way of making the diagnosis. It's important that if you do have those symptoms, you don't do just a lateral flow test. They're important, but for those symptoms that you go ahead and do a PCR test. They're very easy to do, and they rule out the uncertainty, because actually I am, again, being at the surgery today, that, for example, there was one patient and the main symptom was excessive tiredness. They couldn't explain this excessive tiredness for a couple of days, did a PCR test and it came back as positive.
That's a really useful point. A lot of people are getting this misunderstanding, saying I can't have COVID because the lateral flow is negative, but the lateral flow is useful for people who are not symptomatic, have no symptoms whatsoever. And the PCR, if you have symptoms, go get a PCR. It's easy to do. I know there's lots of scare stories in the media about, you have to take forever to book it, but actually it is easy still to do that. Thank you very much for clearing that up. I would like to ask Dr. Zerbachan, because I know Bima did a little piece on this. The vaccine's been around for almost a year now. Is there any evidence to say how it affects pregnancy and childbirth? And we know that our community is predominantly a young community. There are lots of pregnant women who are worried about having the vaccine, worried about the impact it will have on their unborn child. Would you have any advice for them?
Yeah, no, it's a really good question, and it's a really important question for most young women. And a lot of people I've come across worry about this about their daughters as well, teenage daughters or young daughters, if they're having vaccines. How is this going to affect them in the future? Now, we've had a lot of information and a lot of data since the vaccines have been out. The problem is that the way it all started was some problems with pregnancies and problems with fertility. So unfortunately, it's kind of embedded in women's minds that this is what the vaccine's going to do. Now, to date, there's been no evidence to suggest that the vaccines will actually do that. I think what we forget is miscarriages and fertility problems are common. They would affect you regardless of whether you have the vaccine or not. And that's what I think lots of people do forget. What's important to note as well is that many women who have had the vaccine have managed to get pregnant and have their first, second, and their third vaccines whilst being pregnant too, and they've been fine, alhamdulillah. What we also know is when you do become pregnant, and God forbid you do get COVID, you will actually be really poorly, more likely to be poorly than if you were someone who wasn't pregnant. And we can't, there's so many awful stories I've never heard in my career until COVID came out of, we used to hear maybe once in a year there'd be a woman who, during pregnancy had such an awful time with their health that unfortunately the mum dies. Whereas I think in the last year, I've never heard of so many women needing to deliver early, or they become that poorly they need to go to ICU because of something like an infection. I've never heard of it. Like, it's so rare here, and it's so sad to think that something like a vaccination could prevent that. And we know that vaccinations aren't going to prevent you getting COVID, but at least we know that the chances of you becoming really unwell become less, and that's the same for pregnant women. So From the information that we have and the information that's recently been circulated in conjunction with sort of Royal College of Obstetricians and Gynecologists, I would urge anyone who is pregnant or even thinking about becoming pregnant for that not to put them off having the vaccine. You know, we are still in a crisis time. It's the best thing that you can do to protect yourself from the information that we have so far anyway. I don't know if anyone's got anything to add to that.
I mean, to be honest, I remember receiving a call from a colleague who works in intensive care, and it was in the middle of the night, and he called me, and you know, it takes a lot to make an intensive care doctor feel like they can't cope, but he needed to call and just say, this intensive care is full of pregnant women who are about to die, and I don't know how to handle this. And this is, unfortunately, we've had so many stories. There was a very brave family who came forward and publicized a young mother of 5 who passed away, and because she thought that I'd get it just after I give birth, but she never got to that stage. So we just don't need to see these kind of tragedies unfolding anywhere, and would urge every pregnant woman, please get the vaccine. My wife had it when she was pregnant, and it's not just 1 or 2. I mean, the evidence is of tens of thousands of women have had the vaccine across the world, and while pregnant, before becoming pregnant, after pregnancy, and have had no problems with it. On that point, there are lots of people who have multiple health conditions, and this is a question that's been asked there, where people who take infliximab, biological medications, things that lower their immune system, whether it's for colitis or autism, they're asking whether there's been enough research on the booster vaccination. Are these safe to take with biological medicines? Sister Shrifat, as a clinical pharmacist, we look to you.
Yeah, I mean, at the moment, there's not enough research on the infliximab at the moment, but the vaccination is still safe for the patient to take at the moment. But what we say is patients on such medication and biological products can still have their vaccines. It doesn't have any interaction with it at the moment.
Thank you. Yeah, and that's a really important point. Look, we're being honest, right? None of us are snake oil salesmen. We're not here to tell you that, you know, this has got 10 years worth of research behind it, 100%, you know, giving guarantees for anything. What we're saying is that actually these vaccines have been had by billions of people now, and the vast amount of evidence that we've had so far is very positive, showing a high degree of safety, but, you know, no one's writing any blank checks. I think that's a really important point. Thank you so much. An important question for Dr. Hakamal. Someone asks a question about, we have Ramadan coming up in just a few months' time. Are there any special preparations being made for Ramadan or things that we should be doing with regards to Ramadan on the back of, you know, the new variant that's going around?
Assalamu alaikum.
Dr. Hakamal, I think you're on mute.
Okay, so can you hear me now? Well, what Islam is also clearly saying that likulli da'in dawa'in. It means for every disease there is a treatment. So, and it is also highly encourage all these Muslims are encouraged, you know, to take, you know, that benefit of the treatment in the community. So what I'm also saying also in different things, I'm also writing a book about health in Islam, and I'm also going very deep also discussing, you know, with the religious scholars and also with scientists from different way. I think what we as a Muslims, we need to take, you know, the booster dose A1 before Ramadan. So during the Ramadan, you know, still we can take that vaccine. I think what I was also listening to call it, that A1 after Ramadan break, you know, there will be still, you know, vaccine will be available. So our top priority would be to take, you know, that booster dose before Ramadan, and so to protect ourselves and don't leave anything, you know, under Ramadan. And A1, if we also need to see, you know, the severity or maybe, you know, the level of the burden of disease. If it was even severe, so during Ramadan, we can still take it. So there is clearly no Islamic that if our health is also protected us. So I don't see any reason that will, from the religious perspective, that will stop to take the vaccine. And also when it also recommended again, by the public health experts, when we are during Ramadan, if it is really required, so then Islam is always encouraging us also to take care of ourselves. So as I mentioned in the beginning, لِكُلِّ دَاءٍ دَوَاءٍ, it means for every disease there is a treatment, and that needs to be also highly prioritized, and we need to take care of our health.
Thank you. That's a really good point. And actually, you answered two questions in one, because another question was that life and death is in the hands of Allah. So if I will die with COVID, then that's the will of Allah. What is the point of taking precautions? And I think you've answered that question as well with the Ramadan question. And to be honest, we know that in our tradition, it's you tie the camel and then you pray to Allah to keep your camel safe. You don't just throw the camel away and let it roam around and then go, oh God, save the camel. That's, you have to do your part. If you don't do your part, then it's making a mockery of the whole situation.
Yeah. In addition, I just want to reiterate one point. Sometimes we are also missing in our community some of the opportunity that we are having. So this mosque, masjid is the best opportunity place for us to spread also some health messages as well, like Juma pray, Friday pray. That needs to also be highly prioritized. And there is also a study in some Islamic country. So in those countries where, they use, also mosque or masjid also proper health awareness, health messages. So they have more, better, status compared to those Islamic countries, or even 100% Islamic countries, where they were also not using, mosque also for spreading of the proper, health messages. So we need also to properly emphasize of the mosque, and also involve also religious scholars and also community leaders. Some of the innovation that we have been also working in Southeast Asia country, we are trying to find, local hero. Local hero means religious scholars who whatever has, strong influence in the communities. If we can involve them as a main stakeholder, so then they can also encourage community to increase their awareness and also increase, the level of demand for the vaccine. So it's not only the supply side. So in the demand side, we also need to use, Islamic scholars, masjid or other religious scholars, that they are also involved in spreading, Islamic messages. They can still also help us, for these public health messages as well.
Fantastic point. The one lesson that I think we took away from the first year of the pandemic in the Muslim Council of Britain was that the messenger is as important as the message. And that feels almost like a public health revolution, that we realize that, if you put up a public health message on, the Daily Telegraph behind a paywall, written in the Queen's English, then no wonder someone who's not from that community, who doesn't subscribe to that newspaper, won't read it and it won't resonate with them. But if you get it from someone who speaks not even the same language, even for somebody who speaks English, but who's coming from their background, their lived experience, and they understand, it resonates more. And that's something I think that's a real positive, and why we're so grateful for this webinar today and the partnership that's come through it. Dr. Tahseen, before I was going to come to you about a specific question about the booster, because we really want to emphasize the importance of the booster. But Dr. Zerva, could you let us know where people could go to if they want to get information specific to the Muslim community about the COVID vaccine, about the boosters? Where are there any resources out there? There are people asking about there are resources available in different languages and so on.
So my understanding is there are some charities, and we can always circulate their links after the webinar if anyone's interested and they've given their email addresses. But obviously, me being from the British Islamic Medical Association, we have set up a wealth of resources, and we've worked in collaboration, obviously, with the Muslim Council of Britain to come up with sort of information and guidance related to the vaccines, boosters, and basically all things around that. Now, there are some charities, I can't think of the names off the top of my head, but I'm sure someone on the panel will know, and they can possibly put it in the chat. But what they've done is, and it's really good, they're actually London-based as well, but they've essentially translated into many languages of common sort of countries where there are Muslim populations, all about COVID, the vaccines. And I think, I'm not sure about boosters, I can't confirm about that, but there's lots of information on there from, what is COVID, how can it affect you, why is it a problem, to, why do we need vaccines, why are vaccines important, and things like that. So apologies, I don't have the link off the top of my head, but, once it's someone else's turn, I'll just pop it into the chat. So lots and lots of resources. Most general practices will have signposted links as well, where they can help as well, signpost onwards to links. I know it's a big problem because people in our community often feel like there's nothing in their language, nothing tailored to their needs. So people have really tried hard behind the scenes to get that information on paper for them.
Thank you so much. And Dr. Tahseen, I was going to come to you about this important question. We see lots of people who say, look, I know people who've had the booster, they've had both vaccines and the booster, they still caught COVID. They still caught COVID. What's the point? What is the point of taking this booster?
Really good question, and it is something that I get asked quite a lot. And I know many people. Lots of, for example, today at the surgery, there's 4 people off with COVID. Now those people are double jabbed and had their booster as well, but still have had COVID. And I think the key point to remember here is the point of what the vaccination program is trying to do. So if you remember the number of deaths we had in the first and second wave, up to about 1,000 a day. We're not, even though the infection rate is very high, and we're watching what Omicron does really closely, and we're certainly not out of the woods yet. But actually, what it's shown is that the vaccination program, the vaccines have helped protect against very serious illness and death. So actually the point of the vaccines is to protect people against serious complications from COVID-19 and also from deaths. So yes, some people will unfortunately still get COVID, and particularly this Omicron variant. We know that actually having the booster is around 70% effective. So 30% of people are still vulnerable to getting it and will get the COVID. But hopefully, whereas previously they might have ended up on intensive care or maybe even unfortunately dying, now it will be a milder illness, still an illness that might make some people unwell. But yeah, that is the point of having the vaccine, is to lessen the severity of the symptoms.
Thank you. Really important point. Again, it's so clear. The vaccine isn't there to stop you getting COVID necessarily. It's to stop you dying. And that's a good deal, right? That's a good deal. If something's there that stops you from dying, I think I'll take 2 of those, please, or 3 and get the booster. Sister Sharifat, a question to you. Again, I have a lot of people say, don't tell me to wear masks. Don't tell me not to socialize when you've got, entire football matches going on. You've got crowded stadiums. You've got crowded nightclubs. You even got people who are making up the rules, not listening to their own advice. Why should I listen to this advice? Why am I the only one that needs to be putting on a mask and taking care? What would you say to if somebody's feeling like that? And I'm not saying that they're completely unjustified in what they're saying, but it is a feeling out there.
Yes, I mean, I would say the feeling out there, and I mean, for the last couple of months as well, that's what most people are feeling. But I mean, this will increase cross-infection and increase the infection rate. And we know this, generally, that Ramadan is coming. And if we want to go to mosque, we want to have our Taraweeh, and we still want to eat together, we have to make all these guidelines strict. So we have to ensure that when we need to wear masks, in gatherings, we have to wear masks. We still have to keep safe distances as well. And while we're doing this for ourselves, we have to encourage our families and friends and community as well. Because the Prophet ﷺ has said, if we protect ourselves, we protect our neighbors as well. So all of those things are the things that we have to work together. It's not an individual work or an individual decision. We have to protect others as we protect ourselves as well. So nightclubs, ceremonies, festivals, walimas, all of those things we have to look into. When we go out, we wear masks and encourage other people to wear masks as well as keeping safe distances, stay in an open environment where it's where there's air around us. And as states that encourage each other to take the vaccines. This is very, very important at this moment because the rate is currently increasing. And when we look at the way it affects adults, our old sisters, our elderly ones, then we have to look into a way of supporting the generation that is coming after us as well. So I think this is a time that all of us together has to support ourselves and the community we live in. Thank you.
You're welcome. A really important message. We're doing it to protect other people. And this is not an excuse for us to try to look for, shortcuts, because those shortcuts will hurt our own. So, it's not 100% or 0%. It's not like everything needs to be in lockdown. Otherwise, we won't take any precautions. We're doing it not just for ourselves, we're doing it for other people. And yes, it is disappointing when people don't follow the rules, and it sometimes the rules don't always make sense, but it doesn't mean that we stop following the rules. We stop doing what's right because somebody else is doing something that's wrong. That's not what happens in a civilized society. It doesn't happen in a society where people care for each other, the type of society we want to live in. So I think that we can make that case very strongly. Dr. Tessin, there's a specific question that's been asked by quite a few people. I didn't know this until I got involved with lots of organizations for disabled Muslims, but there are actually a large number of disabled Muslims in London and across the country. And are there any specific measures that are being taken to help them either access the information or to make the experience of getting a vaccination more comfortable? They may have needle phobia, they may suffer from sensory overload. Are there any measures in place that you're aware of for disabled people?
Yeah, again, a really good question. So we certainly in our borough have worked quite well with our learning disability team and charities specifically supporting our learning disability and those people with additional needs to try and access vaccination services, whether that's at the vaccination centres, of which there are 2 in the borough, or actually whether it's more appropriate for them to travel to their local pharmacy, which might be down the road. And then it's all about sort of communication with the vaccine centre beforehand to let them know of the specific needs, because it varies from person to person, so that we can make it as comfortable for them as possible. So, for example, I referred one of my patients who has severe autism yesterday to the vaccination centres, and I sent an email to them saying that actually they need to be straight at the front of the queue rather than having to wait in a long queue, because that would cause them distress. And that was accommodated without any problems at all. Also, if there's any, I know that some people are more sensitive to high noise environments, they might be able to be taken into a side room to be vaccinated there. So I think the key thing is to ask, because we are working with all our partners, whether that's with third sector organisations or with surgeries or vaccination centres, to try and make sure that the vaccine access is not only rolled out to the general population, but is equitable. So those people who have additional needs, and those communities that have low uptake, and those groups of people that have low uptake, that we go beyond what's needed to actually try and get them to come in and have the vaccine, because we understand that they may have very specific barriers. So the key thing is to ask, either via your GP or contact your pharmacist, your local pharmacist, and we will make all measures available to try and get you vaccinated as quickly and as efficiently as possible.
Thank you so much. We're coming up to the last few minutes of the webinar, so I do want to get a few more questions in. Dr. Hakamal, people ask questions like black seed oil. This is something that's well established in the Islamic tradition. There are other traditions that involve different herbal remedies. Why can't we use black seed oil to treat COVID instead of getting the vaccine? What would you advise people when it comes to that? Oh, you're muted. Apologies.
So 3 important, very clear message in response to your question, very important question. First, the preventive measure in vaccine is not only to save ourselves, it's also to save the community as well. So what Islam is also clearly mentioning, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا nas jamia. It means if we also save the life of one person around us, it means that we are saving, the whole world. But if it's also in other countries way as well, if we are not taking the vaccines, it means we are also involved in killing people around us. So this is clear. Second thing, what Islam is also mentioning, Islam is also believing on scientific reason. So whatever, the scientist is also recommending, vaccine is, scientific proven, means for protection of ourselves and also for protection of our community. So then we need to follow, this right, or maybe right, correct advice. And the third important thing is, al-Muslimu man salama al-Muslimuna min lisanihi. The right Muslim is the one who is also willing, wishing the same things for the environment and also for others, if he is the right Muslim. So now, if I am also sometime A1 don't considering myself to take the vaccine, so then I need also to take at least, the responsibility of the community. So some of the mistake that if I am doing as a Muslim to protect myself, it's not only limited to myself, it's also limited to the society. So we also have individual responsibility, we have family responsibility, we also have societal responsibility. So considering that three main responsibility, so now from the religious perspective, vaccine is, the highly recommended, advice from the Islamics. We cannot ignore it. And sometimes when I'm also reading, even, sorry if I'm taking 1 minute more, I was just reading, the high level of inequality. Why the supply is the same in every part of the UK, supply is the same. Unfortunately, in those places here we have, A1 Muslim, the vaccine coverage was a little bit low compared to those other people as well. So that is also a big shame also for us as a Muslim, because Islam is promoting, the health. Islam is promoting all those preventive measures. Islam is promoting, healthy lifestyles, no smoking, no alcohols. It is also Islam is also teaching us how to prevent obesity. So Islam is also teaching us how to prevent, to increase the level of coverage of vaccines and all those stuff. If we are not making that one, I think it's like a kind of making also maybe not making a level of problems that can also associate us sometimes as also with the religious as well. So my humble request from all the societies that we are working on it, we need to work with our community to protect them. It's not as academic responsibilities, or whoever is also living in the societies need to take serious action and also participate in that big campaign that at least we need to increase, the high level of coverage of these booster doses.
Thank you so much. As always, there are more questions than we have time, but your questions will be answered. So if you, we'll take these questions away and we'll answer them. Or if you want to email directly, COVID, COVID, @britishima.org or covid@mcb.org.uk. Either of those will get to the partner organizations, and we promise to answer your questions. I'd like to thank our panelists for their time. I'd like to thank the host organizations, especially the Greater London Assembly, the Mayor's Office, OHID, ADPH, NHS England, and the British Islamic Medical Association. But just to finish the last minute with a plea from the Muslim Council of Britain. My brothers and sisters, only a few weeks ago, I was at the funeral of a colleague, a friend of mine who I've known since childhood. He was a surgeon, and unfortunately he caught COVID and passed away. And everything that we say to you, every argument that can be made against having COVID, the vaccine, every argument that can be made saying that the pharmaceutical companies can't be trusted, or why should we have to wear a mask, or isn't there just going to be another variant? All these arguments compared to seeing his two orphaned boys stand alone at the edge of his grave as his body was being lowered in, they paled into insignificance. I'm begging you, we have had way too many deaths, not just in the Muslim community, but especially in the Muslim communities, but in the world. We don't need any more deaths. We don't need any more widows. We don't need any more orphans. We don't need any more people to lose their parents. We need to do what we can to protect ourselves and to protect each other. And as your healthcare professionals, we're telling you that what we've seen is very, very clear. If Omicron takes off, and it already has, if even 1% of those people end up in hospital, the healthcare service cannot cope. If even 0.01% of those people pass away, those are tragedies, those are human beings, and they could be us. So we're asking and we're pleading with you, please, let's each of us do our bit to protect ourselves, to protect our families, and to protect our communities. Wear a mask, get the vaccine. If you haven't had the vaccine, it's never too late. It's never too late to get the vaccine. Start with the first and move on from there. And if you've had the vaccines, then get the booster. And this winter, when people are mixing, just give a little thought to keeping some distance, making sure you have good ventilation, and whether or not we need to expose each other as much as we, as little as we can to the disease. I once again want to thank everyone. Your questions will be answered. This hopefully is the first of many such events like this, but please stay safe, and please take this message back to your communities, because they will listen to you way more than they listen to any of us, because you are part of their communities. You're their family members. You go to their local mosque. You're their friend. Speak to them. Each person that you speak to may be a life saved. Thank you so much. Thank you so much, everyone, for attending, and thank you for inviting us here.
Thank you very much.